Can you explain the low-dose CT lung screening program and what that is?
It is it's a program designed for individuals that are at high risk for developing lung cancer, such as people who smoke or have quit smoking recently within the last 15 years. Other risk factors for smoke or for lung cancer, sorry, include specific occupational exposures, radon exposure, family history, or history of pulmonary fibrosis or COPD. There was a screening trial called the National Lung Cancer Screening Trial, which showed a 20% reduction in lung cancer mortality and a 6.7 decrease in all-cause mortality when low-dose screening CT was utilized in a certain population.
Okay. And so what are the benefits of this lung screening?
So one of the keys to treat lung cancer is early detection. Often lung cancer is detected in later stages when it has compromised the function of one or more vital organ systems or has spread throughout the body. As we discussed earlier, mortality for all causes, including lung cancer, were shown to be decreased with low-dose CT screening program.
Okay. And so are there guidelines that people need to meet to qualify for this screening?
Certainly. So individuals that are high risk and recommend to be screened include people that are ages 55 to 77 who are currently asymptomatic. They do have a tobacco smoking history of at least 30 pack years. So an example of that would be 1 pack per day for 30 years. Or somebody who is a current smoker or has quit smoking within the last 15 years. Also eligible would be people who are 50 or older with a smoking history pack of 20 years or more with one additional risk factor other than secondhand smoke exposure. And some of those include radon exposure, occupational exposure to asbestos or other carcinogens, a personal cancer history or a family history of lung cancer, or disease history such as COPD and pulmonary fibrosis that we talked about before.
Okay. A minute ago you used the word asymptomatic. Can you explain what that is? I know it's more of a medical term, and I know we hear it all the time, but I think for some viewers, they might not know what that means.
Absolutely. So if you smoke and you're currently very short of breath, like you have a symptom from your lung disease, then you're not eligible for the screening. You would almost have to go see a pulmonologist or your primary care physician and be worked up for an actual active disease process.
Okay.
So people who are eligible for screening do not have active lung disease processes.
Gotcha. So they don't have any symptoms yet, but they think because they've smoked or something like that
Correct.
that they could develop.
Correct. They would be put into the program because of risk factors only, not current illnesses.
Okay. And then can you tell us a little bit about how the test and the screenings is performed?
So it is a CT scan. So it isn't a conventional CT scanner. And what we do is we use a spiral CT. We use different parameters that lower the dose from a normal diagnostic CT scan to take images of your lungs. The CT scanner rotates around your body while you're on the table that passes through the tube. It takes about 10 to 15 seconds and is normally done in a short breath hold. There's no need for any contrast, so you won't have a needle stick and be injected with anything. Once the study is done, they will be sent to the workstation where the radiologist will review the study, and then based on what we see, we make a recommendation that were developed by the American College of Radiology using the National Lung Cancer Screening Trial results. And normally when you have your screening exam, we will recommend a follow-up screen in 1 year because you still have the risk factors. Or we'll recommend more advanced studies because we see something that is of concern to us.
Okay. Can you explain a little bit more about what it's like to get a CT scan? Because I mean, I've had an MRI before, and that's a little scarier because you're kind of inside a machine, but a CT scanner is a little bit more open and not as confined, I guess.
Certainly. They look similar. So they're both sort of donut shaped with a table running through the middle. When you're getting a low-dose CT of the chest, or any CT of the chest, abdomen, or pelvis for that matter, you'll lay on your back on the table. The table moves through the CT machine. There's not much noise. MRI is very loud. Yes. And then it's 10, 15 seconds. Like I said, with this study, there's no contrast involved. Other CTs there are. And it's literally you hold your breath, go through the machine in 10 seconds, and the study's over.
Okay, so it's very, very easy and
Very
not real,
easy.
it's not scary if somebody's claustrophobic or anything like that.
Most people do not have any problems with even claustrophobic people in a CT scanner.
Okay.
Some people have really trouble lying flat on their back. That can cause some shortness of breath in itself. But again, this study is very short compared to a normal diagnostic CT.
Okay. And so do those enrolled in the screening program need to be concerned about exposure to radiation? I know we're saying it's low dose, but it's still something.
Yes. So again, we change a lot of the parameters on the machine to generate a low dose of radiation during this short scan. And when we use this technique, the amount of radiation is so reduced compared to a normal CT that the decreased mortality that is shown in the National Lung Cancer Screening Trial greatly exceeds the risk of radiation in this small exam when used appropriately in the population that is appropriate for screening.
Okay. And then can you talk a little bit about what would happen if something is found? Is it then, are you then recommended to go somewhere else or?
So on a screening exam, there are about 4 or 5 different outcomes from what I would see if I was reading the study. You can have no nodules, and that's what we're looking for, nodules or masses in your lungs, but you're still qualified for yearly screening. Or you can have very small nodules and the follow-up is the same. Once we start finding more suspicious things, then you can either be called back for a short-term follow-up, like a 6-month low-dose CT chest, or when we get into the larger masses, we can even move on to a diagnostic CT, perhaps even a PET CT. It's all according to what we find.
Okay.
The majority of people who, the high majority of people who get this screening usually just have to follow up within a year. But the point of getting the screening is if we do see something suspicious, yes, we will immediately move on to more advanced imaging techniques and follow up with the appropriate providers.
Okay, so it's things that can be monitored and it's not always automatic, you know, you have lung cancer.
Absolutely. And I would advise also if you enter this program because you have the certain risk criteria, even if you have the first normal scan, you're, you know, it's screening for a reason. It's
Right.
not, hey, I had a normal scan, I'm good, I'm done. You need to follow up with the recommended like yearly screen until you reach the age where screening is no longer recommended based on the trial.
Okay, so it's similar to a mammogram, but it's not something that's been around as long to.
Absolutely.
So we're trying to.
Yes, the screening process is absolutely the same. It's the same premise, just like screening for any type of cancer, because we want to catch it early.
Right, because early detection saves lives, right?
Absolutely.
I guess one more thing, what can people do, I guess, to decrease their chance of being diagnosed with lung cancer in general?
Well, quit smoking is the main thing. There's in 2017, there's certainly no doubt anymore that smoking results in lung cancer. And St. Tammany Parish Hospital does have a smoking cessation education program. It's offered at various times during the year.
Okay, awesome. Well, thank you so much for being here with us, and I appreciate you sharing information about this screening, especially since it is so new and it's something that we really need to make sure people know exists.
Absolutely. Thank you so much.
Thank you.